Heather Walker has been a pillar of the Boston Celtics organization since 2006, most recently as vice president of PR, with her hand in everything from organizing events to ensuring players and their families are taken care of on the road or at home with whatever they need. But in recent months, the mother of two has had to focus a lot more on taking care of her own needs after being diagnosed this past July with glioblastoma, an aggressive form of brain cancer, the same Senators Kennedy and McCain and the president's son, Beau Biden, all had. Heather has since undergone radiation, chemotherapy, surgery just 8 days before her 50th birthday. But even though through our own fight, Heather continued to do as she's always done, try to help others. She's created the Move for Heather Challenge, she'll explain it all to you in a minute, to raise money for research into a new personalized type of treatment she's been getting as part of an MIT study. Heather Walker joins me along with the man who's leading that work, Dr. David Reardon, the clinical director of the Center of Neuro-Oncology at the Dana Farber Cancer Institute. It's great to see you both. Thanks so much for being here.
Thank you.
Heather, how are you?
I'm doing amazing, actually. I had my last Neovax vaccine a few days ago, and I'm coming out of it. I just started doing the Peloton again and running, and I'm feeling really good. You know, I think part of this diagnosis is movement, and that's why I'm really, I love the hashtag that we have, hashtag Move for Heather, because it's movement. The more that you move and the more that you exercise, the better off you are and the better off you feel.
So we'll talk about that effort in just a second. Dr. Riordan, she says she's doing great. How is she doing?
I fully agree. She's doing fantastic.
Could you describe, Dr. glioblastoma? Because I'm assuming, other than the fact that some very high-profile people got it, most of us don't know it other than it's the fact that it's rare and often quite deadly. Tell us something about it.
Sure. So glioblastoma is much less common than lung cancer, breast cancer, prostate cancer, but it is the most common type of cancer that affects adults in the United States. It arises in the brain and is what we consider a primary central nervous system or brain tumor. We don't understand why it develops, but there are about 13,000 cases in the United States each year.
You know, doctor, staying with you for a second, I didn't know anything about personalized vaccines. I'm watching an interview that Maria Stefanos did with Heather when she got the news that the vaccine was ready for her, which was really a time of exultation. Explain, this is a personalized vaccine, personalized meaning specifically for Heather and her needs. Is that right?
That's correct. This is a vaccine that we have generated. This is a Dana Farber Cancer Institute effort led by my colleague, Dr. Kathy Wu, and we do it in collaboration with MIT, but it is a Dana Farber effort. We take each individual patient's tumor and do a deep analysis of the genetic blueprint of that tumor. And we know for each patient's tumor, their genetic blueprint is going to have unique features associated with their tumor. And based on the technology we now have access to, we can identify those unique features for each individual patient's tumor and develop a vaccine specific to their tumor. It won't help the next person and it won't help the person before them. It will only help Heather or the person it's designed for.
You know, Heather, everybody who knows you, who I know, says the same thing. You're the most relentlessly positive person they have ever encountered. They say other wonderful things about you too. Do you spend time feeling sorry for yourself, or do you not have time with that? How do you deal with that?
I don't. I mean, Jim, my dad died of cancer when I was 16, of leukemia, and there wasn't a chance. He had a year to live, and since he passed away, this fight has been in me, and it's something that I feel like I was just born to do this. And the fact that I met Dr. Riordan and this incredible team at Dana Farber, I'm so blessed. And so I just feel like I'm in such a good place because of this team and of doctors that I have. And I don't feel sorry for myself. I don't, because I get up, I go for a walk, I go for a run. I'm surrounded around amazing, positive people I have two young girls, Samantha and Taylor. They're 10 and 12 little girls, and they're positive, and I want to be strong for them. And it's like, and I want to survive this,
Can we talk?
and I know, sorry. I know it's a deadly, scary disease. I'm fully aware of that. But there are long-term survivors that have been getting through this. And, it's good nutrition, it's good exercise, it's listening to your doctors, it's all of that, all combined into the same thing. And if you can do that, and also connecting with other glio patients. I connect with glio patients every day, and we talk about how we're feeling in the day and what's going on. So it really makes me feel amazing. I mean, I got chills just talking about it, because it's just like, it's incredible to be in this position and feel this, because I'm really excited about what's to come.
Can we for a second, Heather, talk about your other team? You talked about your team of healthcare providers. I spent my afternoon, I was not feeling so great, and I was going to watch 2 minutes of a birthday tribute to you from Celtics past and present. I decided it was so great to watch the whole damn thing. Here's just a little piece of this from somebody I have a feeling most people will recognize, Shaquille O'Neal. Here it is.
Heather, it's me, the Big Shamrock, your favorite Celtic. One, I want to say happy birthday. Two, I want to say I love you. And three, I want to say I miss you. And I'll be seeing you soon. Kiss those babies for me, okay? Love you, Heather.
And then you're recognized as a hero among us by the Celtics a couple of weeks ago. You're there with your family, and we're going to show a little video, and you end up kissing Steve Pierce. Tell us about this hashtag M4H. You started to touch on it before. What exactly are you doing there?
Well, when I woke up from my surgery, I thought to myself, I'm like, we have to cure this. Like, we have to do something like that. I mean, I'm not alone in this. There are a lot of people that are suffering from brain cancer and glioblastoma. And the way to do that is movement. And it's my mom's best friend sewed a quilt, it's going for a walk at the beach.
Do something.
It's doing something that is positive, that makes you feel good. When I woke up from the surgery, I thought, do something that feels good every day. Do one good thing that makes you feel positive. And it's been working for me. And it's been working for other people. And it's just amazing. I mean, we had a friend skydive, out of an airplane, and so it's called #MoveForHeather. And basically you come up with something that you want to do in your bucket list, and then you tag two people, and they will do it. And it's been just spiraling, and there's so many fun, like, different things. And it's so great to just see what people are doing, especially during COVID. You really weren't able to get out there and do anything.
So that effort, Doctor, has raised several $100,000. I know that you're focused laser-like on this. Where are we? What's the progress that you've made?
Well, the funding that we get from philanthropic efforts like this is crucial, critical. There's tremendous advances that are being made with our research and science. Being able to translate those to help patients is a big step. And in order to do that, we need pilot data. If we have preliminary pilot data from some of our ideas, some of our possibilities, we can then take that forward and leverage that for additional grants and other funding mechanisms. But if we don't have that pilot data, we don't get off the ground. Things don't move forward. So this whole effort wouldn't have happened without this type of effort, raising money to get a good idea off the table and moving forward.
Well, Heather, you have a lot to be proud about, and I know all the people who love you feel the exact same way, and I wish you good health. And Dr. Riordan, I wish you great success in your work, and I thank you both for spending time with me tonight.
Thank you very much.
Thank you. Good luck.
Thank you.
You can donate by searching Move for Heather on the Dana Farber Jimmy Fund My Fundraising page.